Thanks for joining us today for the second session of our workshop on narrative power, where we're going to be discussing how our collaborative imagination can be a catalyst for a healthier and more equitable society. My name is Omar Dawahere, and I'm director at Partners for Advancing Health Equity. For those not familiar with our work, we're a research learning collaborative based in New Orleans at Tulane's Celia Scott Weatherhead School of Public Health and Tropical Medicine, and we're funded by the Robert Wood Johnson Foundation. Our work aims to harmonize health equity efforts by multiple sectors to promote actionable tools and solutions towards a healthier and more equitable society. We do this through public programming, wealth of collaborative sourced resources on our website, partnerships that we do with multiple organizations, projects, and professional development for early career scholars. We're very excited to be hosting in collaboration with our fabulous partners at Partnership for Southern Equity this the second session of our workshop series. And this series is part of our quarterly learning journey series of activities where we tackle collaborative source health action priorities through a variety of monthly programming. More on this through a link that we're going to be dropping on the chat. And just a very quick note before introducing our speaker and facilitators for the day is that I want to let you know that this session is being recorded for learning purposes and your identities and likeness will remain anonymous. So without further ado, I'm going to pass it on to the PSE team who are going to introduce themselves. So I'm going to pass it on to Kirsten. Thank you all for being here.
Thank you all for joining us. We are glad that you're here, and we hope that you will engage throughout this session. So you can engage with us in the chat. You can drop in questions, reactions, and reflections at any time, and we will make sure to be monitoring that. We will have some dedicated Q&A time near the end of the session. And then if you would also like any questions that you see in the chat that you would like for us to address, we will make sure to center the ones that have the most likes. Next slide. So this is our team from Partnership for Southern Equity. Nathaniel Smith is our founder and chief equity officer. We got to hear from him last week. So if you missed that one, please go ahead and listen to the recording. My name is Kirsten Cook. I am the Director of Research and Analytics. I'll be introducing Robin Bussey in a minute. And then I'll also let my colleague Opal Gay introduce themselves.
Hi, everyone. If you're joining from last week, hello again. This is the first time. My name is Opal. I'm a senior research analyst here at PSC, and so happy to be in community today.
All right, next slide. This series of 3 webinars is inspired by the Circle Initiative, which is a project we introduced in the webinar last week. Circle is a PSE-led project that stands for Community-Informed Research for Change, Learning, and Equity, and it is an initiative to develop a collaborative ecosystem of community-centered research experts across the U.S. South. As these webinar series go, the first session is focused on Learn. So we introduce narrative power as a pillar of PSE's mission to advance racial equity. In this session, we will have more discussion, and you'll be learning from Robin about the Just Health narrative training. And then in session 3, we will get to create together. And then in the first session, we also heard from our founder and chief equity officer, Nathaniel Smith, about PSE's word for the year, which is imagination. And we learned about the critical role that imagination plays in narrative power. And now I want to introduce you to our primary speaker for today, Robin Bussey. Robin is the Just Health Director at the Partnership for Southern Equity, or PSE, where she leads initiatives advancing health and racial equity across the American South. Her work focuses on climate and health equity, access to care, and reproductive justice. Robin brings extensive experience in community engagement, policy development, and health equity strategy. Before PSE, she was the community health strategist at Archie, which is the Atlanta Regional Collaborative for Health Improvement, and previously held the role of senior research associate at the Georgia Health Policy Center at Georgia State University. Robin is a proud native of Waycross, Georgia, and she currently resides in East Point, Georgia, with her son, Kemp. And I have personally had the delight of working with Robin for almost 5 years at PSE, and I can say she is a gem and a wealth of knowledge. And I'm excited about this opportunity that we all have to hear from her. So take it away, Robin.
Thank you so much, Kirsten, and thank you all. It's great to be with you all today. If you will, just we'd love to know where you're from. So if you don't mind, just dropping in the chat your name and where you're from. And I say that because we're going to kick this off. As you see, we have to shout out where we're from. We got to shout out Atlanta. So, hence the Outcast reference. But what we're going to talk about today is using narrative as a tool for communicating health equity. And I see that my screen. So jumping in, why narrative? And we talked about this a little bit last time when Opal shared how narrative really drives change, how stories are a collection of narrative and why it's so important to be able to shift the dominant narratives that are out there. So this is from Race Forward, an excellent organization that definitely uses narrative power to communicate all things racial and social equity. But they're sharing here those dominant narratives that are out there seem to be able to shape policies that we're seeing right now. There is a group that shares that there's kind of this triangle where culture is at the top, we have economics or politics on either side, and essentially they say that culture changes faster or moves faster than economics or policy, but the job of culture is to drive the other two toward justice, and narrative power is foundational to moving politics and particularly economics toward justice.
Robin, I think it actually is frozen. My apologies.
It's okay. And I'll keep going. So when we talked about, so yeah, you get to see real time facilitation, which is fun. And as we mentioned last time, one of the words that we use in our word for the year is imagination. So I'm really going to ask you all in the meantime to use your imagination and just kind of think about what I'm trying to show you as I'm talking about this. So we're really going to lean into the power of narrative right now. So you're going to hear a lot from me before you can see all the pretty pictures I tried to make for you all. But essentially, Race Forward has created this what's called narrative ecosystem because those of us who are in academia and research, we love a good framework. And essentially, it is a pyramid in which the deep narratives are at the very top, and at the bottom are messages, and right before that is stories. And each level really builds up. It's a bottom up model. And essentially, messages are kind of those pictures, those stories, those images that create stories. Stories are, we collect those, they collectively form narratives, and then narratives, of course, move into those deeply held narratives or the dominant stories that we hear very often in culture and in our society. And, some examples, they can be great dominant narratives and they cannot be. So, one that we hear a lot are, what's the slides are working, is that I just can't see them. Um, Everyone deserves good health, right? But then the narrative is that health is the individual choice. So if you're not healthy, if you're not eating well, if you're not, engaging in physical activity like you should, then it's your fault. If you have all these instances of chronic disease, then it's your fault. Um, okay, I can't share the slides, so I'm going to keep going. So, one of the things we try to do with communicating stories and developing narratives is to really try to shift those deeply held narratives that individuals are responsible for their poor health and really try to place it back where it should be on systemic structures that influence health. I'm not sure if you can see the slides or where we are, but I'm going to keep rolling. So, one of the things we want to think about, and we're really going to dive into stories because those are the basic units of change. Those are the things that we can control. We can really start to collect. We can analyze to start to be able to shape and drive narratives. And so, first, we're going to talk about what makes a good story. You've heard stories that are compelling, that really make you think, that make you want to take some type of action. And at the same time, you've heard stories that, really focus on trauma. They really try to sympathize, make you sympathize with someone, and hopefully, again, drive change. But that's essentially what stories do. They're really there to make you think. But what makes a good story, particularly in the frame of health equity? What we want to do is make sure that we can humanize the issue. I can't see the slides, so I can't, for some reason, I'm unable to see them. I just see me. So I can't tell you I don't even know where we are. I'm just rolling.
You're present. The slide deck is present, so I would just cue whenever you're ready for the next slide.
Okay. Well, I will pull mine up then and just go along. So we should be on data changes minds, story changes hearts. I'm going to assume we're there. That's something we share all the time at PSC, Partnership for Southern Equity. We a lot of us, particularly myself, we love tables, we love maps, we love numbers, but those things really get you to think about an issue. But stories again serve to humanize what's behind those numbers. Who are the people behind the numbers? How can we start to really address fully, comprehensively address the issue with stories and with numbers together to create that to start to change that narrative. Next slide. So these are some tips and techniques about the art of storytelling. So again, what makes a good story? They need to have these elements. They need to be relatable, meaning that it's not in relatability. I need to really say it's not the same as respectability. So we're not necessarily trying to make the story fit, someone's again narrative. To use that word again, we're really trying to make sure that we're being authentic in telling the story, that we're really bringing what the storyteller intends us to share to the story. Agency. So again, we're not trying to make you feel a certain way. We want you to derive meaning from what the storyteller has laid out. Simplicity. There's no need to, use that flowery language. How sometimes it can be really editorial. There was snow falling in a quiet meadow as I was talking to XYZ. No, we really want to get to the heart of the story. What is the issue that we're trying to discuss? What is it that someone wants to convey? And immersion, they really want people to be drawn into the story, how they can, and it also goes with familiarity. You want to feel like you're in the story. You want to feel like you can relate to the storyteller. Oh, okay, that could be my cousin. That could be my best friend or my neighbor. That really drives folks to action. And then I know simplicity and drama can sometimes seem at odds with each other, but they're very important to telling a good story. Basically, drama means that you tell everything. You tell the ups and you tell the downs. You don't necessarily have to, again, try to make it fit into a particular mold because you want to be authentic in telling the story. And trust is really essential. Do you trust the person telling the story? Again, is this person authentic or is this actually their lived experience? Or are they really trying to communicate something in a way to shape narrative, to change, to really change someone's mind? Or did this really happen to them? Is it someone who is maybe cosplaying a particular experience in order to relate a story? So all these things need to be present when you're crafting a good story. Again, in that effort to change narrative. Execution, passion, and language. I'll say more about language. Language is critical in this work, how the words that you use. I'll say again, you'll see later, words mean things. There's a way to communicate almost anything, but you need to make sure that the language that you're using really hits there. It's relatable, it's familiar, and it builds trust. The story has to be linked to an overall message. What is it that we're trying to get to? What are we trying to convey? What are we trying to drive home? If we're trying to change people's minds and hearts around health and equity, how are we able to do that by telling this story? Of course, this is more believable if it's true. We've all heard these false narratives. People, living certain lives or people having had certain experiences. There are books all about this, and things are later uncovered. This was not true. This was not this person's story to tell. So, really, we want to make sure these stories are authentic. And again, know your audience. So, who are you telling the story to? Is it decision makers? Is it other folks in academia or other researchers? Are you talking to community members? And then be able to adjust the message depending on who it is you're talking to. Next slide. So hopefully you're seeing this beautiful woman's face. Her name is Susanna. And this is an excerpt from some work I did a few years ago to be able to basically convey health. We're working with the area on aging in a local community. And what they wanted to do when they started to talk about health equity is that often older folks are left out of the conversation, and not just older folks, but older folks who represent different communities and different identities. So what they wanted to do was collect stories from older folks and how they actually experience health inequity. And we talked to a lovely Korean couple. I talked to a woman who truly had experienced a time when when she went to the doctor. There was only one doctor in her town, a white doctor. She had to enter through the back door, and this was in the 70s, so not that long ago. So she kind of conveyed her experience and how that had changed. And this particular story stood out to me, and I can say that this was probably done at least 7 years ago. And I think about this story very often. This is Susanna, and she lives in the city of Clarkston. And I don't know how much you all know about Georgia or about Clarkston, Georgia in particular, but it's called the most diverse square mile in America. It is a refugee resettlement hub. It is not very big at all, but you can encounter cultures from all over the world. There are at least I can't remember the number, but I want to say over probably 100 different languages spoken in that community alone. 45% of the population is born outside of the US. So you can imagine this particular, the folks in this community is very rich in culture, and it's a beautiful place. But I was able to get introduced to Susanna, who wanted to share her story. And essentially, she had been in a refugee camp for 20 years after fleeing war violence in the DRC and Burundi. She had very recently moved to Clarkston from Tanzania, from that refugee camp, to live with her daughter and her daughter's 8 children in a very small apartment. And she really talked about the issues that she was facing. She has diabetes and a dental issue, and as you can imagine, she does not have insurance, so she wasn't able to access care. She did not speak English very well. She had to rely very heavily on an interpreter. When she was able to receive care, she did not have transportation to just go whenever she wanted to go. She had to rely on a neighbor, and of course, the English barrier became more of an issue. And to add to all of that, her documents that she was able to get from the refugee camp showed that she was actually younger than she was. It showed her birth year is 1959 when she was actually about 9 years older than that. So that affected her ability to be able to get benefits and services to be able to address her chronic care. And, just hearing that story, and there's a whole transcript, but it had to be summarized. There was so much to convey. And what I really wanted to make sure I did is not, portray her as a victim in any way. Yes, there are lots of systemic circumstances that were kind of working against her, if you will, but she still had hope. She still wanted to be able to contribute to her family, to her household, to her community. And she was really adamant that there had to be some way in this country to be able to do that. And so this is just a quote from her, and I can't see it, but hopefully you all can read it. But then just looking at her, she's just a darling soul. And all that to say is that being able to first earn her trust, to go into her home, to be able, and then her trusting me with her story, and the others trusting me with their stories, was huge. And then to be able to be true to that story was really important. So again, thinking about those things, I had to make sure that in conveying it, there was relatability, that there was familiarity. Yes, she was from Burundi or the DRC, but you can still recognize in her story the need for social cohesion, to be able to find community when you're someplace that is actually foreign to you. And then hopefully, again, by collecting her stories and other stories like her, we begin to shape the narrative that folks aren't coming over here and maybe relying on the government to take care of them. They really want to contribute, but there's a lot of systemic barriers in their way and keeping them from doing so. Well, that's just one example, and I'm glad to share her story and the other stories if anyone is interested. Next slide. So, how do we take all of this and use this to actually start to advocate for policy, health equity, and policy? Again, we say at PSC, and we share all the time, that policies are actually a reflection of the values of people in charge. And so we know values are a huge part of culture, that stories really record our values, and how do we, craft them and share them in a way that starts to maybe chip at some of those value systems that create some of those dominant narratives that perpetuate and reinforce inequity. How do we start to really as a community, as a workforce, as a whole, start to take those and use stories to again move up that ecosystem to change those narratives, and really counter those harmful narratives so that we can start to influence policy. So I'm just going to highlight only a couple of these. This is not an exhaustive list, but these are things that are really important. Community collaboration is huge. Authentically engaging and earning the trust of folks in the community to be able to again share their narratives and share it in an authentic way, not just for the sake of sharing it, but again in hopes of really driving change. Picking those messengers strategically. Who are the folks that will have you immersed in their stories? Who are the folks that you'll be able to relate to, regardless of who you are? Language is really important. I'll talk a little bit more about that. And I've said that more than once. Demonstrating the greatest need. There's so many issues that we need to tackle, but what are those things that we can really see some movement on? And particularly when we're talking about policies and politicians, how do we show how everyone benefits? That's really important, as well as anticipating the economic costs. This says use data. In this particular context, when we say using data, we're talking about quantitative data. Those numbers, those maps, and those tables. We want to use those because those help build a comprehensive picture, really flesh out a story, but we don't want to overwhelm because again, sometimes people, you can show them maps and things all day, but that's not what's really going to drive that change that we need to see values change and then in turn policy change. And then using the health equity perspective. The health equity perspective requires us to really focus on that upstream, those upstream changes. What can we do to make changes at the systems level to really drive the change that we need to see, as opposed to, more downstream kind of programmatic activities, which are important. But again, to really move in the direction of health equity, we want to see systems change at the top. Next slide. So, words mean things. I use this all the time. And yes, I did steal that from Crystal of the podcast, if anyone is interested or anyone's familiar. There is a way to, I love Crystal and Kid Fury. There is a way to, say almost anything. I think, again, we need to just be mindful of how we speak. And just because, people have said things and done things before doesn't mean that it's okay. And that's how we should continue to do things. So this is just an example of how we kind of change some language. And when we do this, and let me just make this a small excerpt. What I'm doing probably in 25 minutes is trying to really distill a training and a talk that can take at least half a day. So I'm really trying to kind of hit the highlights here, but we do a really deep dive on language and words and definitions. We talk about the difference between health disparity and health inequity. There is a difference there. They're used interchangeably, but there's nuance between the two. So we really want to make sure we're using language because that is really critical when we're building our narratives, again, to drive that change. So here, again, we want to make sure we use us or we. We're not, again, focusing on choice. We're not saying it's them. It's others. We're really focusing on the belonging and the cohesion and familiarity that we all should have as a whole community, as the beloved community, if you will. Opportunity for all. Again, we're talking about systemic change, the systemic drivers, and again, not choice, that not the individual responsibility of, well, you should eat better. You should, eat like 4 servings of vegetables a day. That's great to say, but if I live in a community where there's one grocery store and probably the freshest thing in there is, some 3-day old head of lettuce, then it's really hard for me to eat healthy, right? Or if I have to drive, um, 20 miles to get to the nicest grocery store, which is in another neighborhood, it's really going to be hard for me to eat healthy. And, in today's economy, how can I afford that? When, Takis are 3 for $1 versus, something more, kale, for example, being, about $5 a bushel. So really thinking about how we use the language to frame what's really happening. Again, people thrive versus people deserve, because there are some audiences where you can't say that because, again, who's deserving of good health? Who should have good health? That can really be a counter argument. And I think we've all seen how we try to really not use vulnerable or at risk. We really want to use people centered, people first language. So people experiencing certain conditions, people experiencing homelessness, people experiencing chronic disease, and again, using not using disadvantaged or poor where we can, but people who are in communities that have been historically and intentionally divested or excluded. So while some people may feel like that's kind of the politically correct tack to take, it's important because we want to make sure that we're centering all folks in this work, particularly the folks who are closest to the problem, because as was shared previously, we believe that those closest to the problem have the solutions. And how can we lift that up? And again, using language that includes these folks and building their stories is really a way to get to those solutions. Next slide. So something I talked about before in those tips and techniques is health equity perspective. Again, that upstream perspective and really placing the focus on systems versus individual choice. So I can't see this. So I think when you click, you will see an alternative. But we typically ask, particularly again, those of us in the public health space, those of us who are doing research and trying to really figure out what is, the work that needs to be done. What interventions can address health disparities is probably how we would typically ask the question, but the health equity perspective calls us to ask it a different way. What generates health equity in the first place? What are those root causes? What are those systemic drivers? We ask all the time, I think this is the prevailing question: what social programs and services are necessary to drive or address health equity? When we should ask, from the health equity perspective, what kind of public collective action is necessary to confront health equity across identifiable populations? It's a few more words, but it really gets to what we're trying to get to. It gets to the crux of the issue. What can we do collectively to be able to confront those health equity barriers across identifiable populations? And again, we recognize that there are subpopulations within each group. When we talk about minorities, we want to talk about groups who are underrepresented in certain populations. So again, being mindful of that language and also using that health equity perspective. How can we create more resilient communities? I think that's probably a prevailing question that, we've asked ourselves a time or two in this space. But, health equity perspective requires us to reframe that question. How can public health protect communities from things like disinvestment, redlining, predatory lending? Again, those root causes that drive health inequity. Next slide. So I don't expect you to read this. You will get a copy of this, but these are just some things to consider when we are crafting narrative. Of course, centering lived experience is very important. Those closest to the problem have the solution. But when we're centering lived experience, we want to make sure we're centering authentically. Again, we're not exploiting, we're not extracting, that we are really treating people's stories and their narratives with care. So these are some questions that we would ask ourselves. Again, whose story would you tell? So thinking about the messenger, picking that messenger strategically, and making sure that messenger is relatable. And that story is relatable. But again, how would we ensure that that person's experience is treated with dignity and complexity? We want to make sure that we're not just, making a victim. We're not just, creating all of these terrible circumstances or perpetuating these terrible circumstances. But how can we make sure that they feel comfortable sharing the story with us and then feel comfortable with their story being shared more broadly and getting to solutions? Again, connecting stories to systems. We want to make sure that they're connected to the larger issues at hand. We're not focusing on individual choice. Blending narrative and data, again, data in the quantitative sense. How do we kind of weave in numbers and statistics to really create a full story? Really important, shifting from deficits to strengths. Again, not just honing on what the things that are wrong. What agency and what power does this person have? Does this community have? Because as we said last time, everyone has power. So we're not empowering anyone to do anything. We don't have the power to do that, if you will. Everyone has some sort of power. So how can we make sure that person, that community's power is coming through in their story? Tailoring for the audience. who are we speaking to? Who are we speaking to? A large group of folks of all kinds? Are we speaking to, again, policymakers? Are we speaking to our fellow community members? Who are we speaking to? And what do we want to make sure, what values do we want to make sure we lift up? So again, that story really hits home and can drive folks to action. And of course, most importantly, moving toward action. That's essentially what it is we want to do. This is all about systems change. So the story, I mean, we have to ask ourselves always at the end, what do we want listeners to understand, feel, or consider differently? And then most importantly, what do we want them to move on? So these are all the things that we want to consider when we're crafting narrative, both to, again, collect those stories and then to be able to use those stories and those narratives to drive public policy. So I apologize for the technical difficulties, and I'm going to stop here. I believe to see if there are any questions, we can go to the next slide. And I can't see the chat either, so my apologies for all of that. But if you have any questions, please put them in the chat or feel free to come off of mute and to share. And if you don't, that's okay because I'm gonna put you to work.
Robin, I just want to lift up a couple of things. First, I want to thank you for for modeling exactly what you were talking about in real time.
Thank you.
It's a beautiful thing, and it really is, because a part of what you said is about authenticity, and it was definitely authentic, and appreciate that. One, two, appreciate the health equity lens and the difference that that makes in shaping the language and how we use it. I know everyone on this call understands the power of language.
Mhm.
We see it every day in its misuse. And many of us remember how it used to be used in a
Yes.
way to um, inform and lift up and strengthen. So appreciate that attention to detail and that focus on that health equity lens, because that is the crux of the work that we do. And you are helping us to have the language needed to talk about it in a way that brings the change and the impact that we want to see. So thank you.
Thank you so much. I appreciate that. And I also want to lift up, this is a practice, right? We have to keep doing it. We have to keep iterating. We don't get it right. We don't get it perfect every time, probably rarely, if often, if ever, but we definitely want to make sure we continue to remember all these things and implement these things whenever we can. So thank you so much for lifting that up.
There's a question in the chat, Robin,
Uh-huh.
from Aaron. They ask, how would you describe the difference between health and equity and health disparity?
Yes. So I have a slide for that. I can't show it. So health disparities are simply, a disparity is simply a difference, right? So a difference in health or outcomes for folks. So one of the examples that we use is that, and I'm trying to remember this off the top of my head. Uh, so babies who are and I'm going to use language, who are assigned male at birth tend to weigh more than babies who are assigned female at birth. That's just that's just a physical biological difference. It has nothing to do with gender. It's just something that we see and we observe over time. Similarly to cancer rates tend to be higher in older adults than they do younger people or children, just because again older people have lived longer, they've had more exposure to different things, and we just tend to see rates of cancer be higher. Again, these are just physical issues. But when we talk about health and equity, these are the things, these are changes that are driven because of structural issues, right? So when we see the difference in mortality in breast cancer between Black women and white women, we have to think about, it's not because Black women are Black. It's because of, many things, systems issues. They tend to be screened later because they tend to not have the insurance or the access to be screened earlier. They tend to be, exposed to more environmental factors that can lead to certain cancers than other folks do. So the difference really is the system's influence. So a disparity is just a change. It's just a difference. Inequity is a difference driven by systemic change or systemic issues. I'm sorry if that helps. Oh, you're welcome. I couldn't see that. There any other questions? Because I want to stop talking for a minute and let you guys practice. Yes, I see a hand. Lily?
Yes, thank you so much. Please let me know if my Wi-Fi is acting up again and it buffers. This was so powerful. Thank you so much. The reason I raised my hand was to ask about resources. I'm a family caregiver advocate, and I was so amazed the first time I traveled to the South when an elderly African American friend's friend said, "I have the sugar." I had never heard that before. So
Mhm.
I'm wondering if across the United States anyone is compiling sort of like a glossary of vernacular. Because I know in the Chinese American community that I'm from, folks will not, because of stigma, talk about, mental health issues. So they use vernacular. So I just wondered if through the wisdom of the crowd, we could all start compiling glossary of terms that are not the scientific terms, but what are actually used by communities. Thank you so much.
No, thank you, Lily. I think that's powerful. I've not seen that, and I think that would be so helpful because I think we've all heard those examples. Like again, when we talk about the need for culturally sensitive care, because we're again culturally competent is a term that we need to move away from, and culturally aware care. That's critical, right? And it's not because there's any type of it's anything wrong with it. That's just how communities and cultures communicate. So how can we start to kind of break down those barriers and make sure that we share that information? I would love to see that actually. So yes, I think that's something we can work on.
I'll
And we
share
can
my email and then maybe we can be in touch. Thank you so much. This was
That
so
would be great.
powerful.
Yes, thank you. And again, that's an example of how we start to kind of come together and share information and share those stories that you shared to again start to change narratives and change how we work. So thank you so much. Are there any others?
There's one more question in the chat
Mhm,
from
mhm,
Ivy.
mhm.
The question is, any recommendations for alternative words for empowerment? There are some programs that use this within their office name or title of a project. I'm
Yeah.
curious what else is out there.
We like to say is how do we share power? How do we organize power? Align power. I talk about words meaning things. I made up a word. How do we collectivize power, which is I think, some hybrid of organize and really bring collective power together. But yeah, there are definitely ways to do that. And even you can even say again, is using a few more words. I know sometimes we don't like to, we like to be as succinct as possible, but we just, we say everyone has power. How do we, lift that power up? How do we pass the mic? How do we share it? How do we highlight it? How do we organize it? And realize no, we don't have the power to give to anyone else. So even if you have to use all those words, I think that's possible. But again, I think facilitating power or sharing power will probably get to what you're saying instead of empower. Mhm. Any others? And again, thank y'all for rolling with me with this these technical issues. So if we do not have any other questions, what I'd hope for you all to do, again, this is part of a much longer interactive training. Is that Cara, you have your hand up? I'm sorry.
Yeah, no, that's
Cara, is
thank you.
that correct? Okay.
Yes, thanks. Um, so I'm just going to read what I wrote in the chat because I
Yeah.
wrote the bootstraps narrative is so strong in so
Yeah.
many audiences.
Yeah.
Um, so I'm sure all of or the vast majority of us on this call really understand and appreciate that we're all part of a collective and that everyone's health. It's like we are not healthy unless everyone is healthy.
Yeah.
How do you adjust that? That's not the case, for in a lot of audiences. How do you adjust narrative components like frame, messengers, whatever other components to counter or head off that argument that other people's communities don't affect me or don't affect my community? Or, Margaret Thatcher said there's no such thing as community. There are men and there are women, or
Mm-hmm.
something like that. I'm not, I'm paraphrasing.
Mm-hmm.
And that is so strong. So I mean, so much of our narrative in health equity relies on people just accepting that we are in a society. And so how do you adjust for that?
Mhm. So, it's really important to bring in historical perspective. So, how did we get here? Thinking about policy decisions that were made that created these divisions and these inequities in the first place. You have to name those. That's going to be critical. And then, you can even use a phrase we've all heard before: a rising tide lifts all boats. But then you got to explain how it does, right? So you have to show that if my community is healthy and thriving, and we're able to, adequately contribute to society, all that's going to do is make it better for you. And then we also have to shift our perspective from one of scarcity to one of abundance. That just because I win doesn't necessarily mean that you lose, that we're not trying to take anything from you. So it's really, using data, when I say data, again, the quantitative data that shows, again, we talk about the economic costs. If, this community is healthy and thriving, then you have a whole, group of people who are contributing, who are paying taxes. If this is a group that you're talking to that's really, interested in that, they're able to increase the tax base, which then, allows us to pay for more goods and services, which then you will also benefit from. So it's really about trying to shift the perspective, from, again, that scarcity to abundance, which does not sound scientific, but there are ways to do that. You have to use the data to be able to do that. Naming the harms that have happened that have disadvantaged other communities and benefited some other ones, and that's kind of where we get stuck. I think sometimes a lot of people, particularly, I'm in the South. I think in the South we have a unique perspective about that. People don't want to hear that, but that doesn't make it false, and it doesn't make it, something that we have to negate or minimize. This is something we have to raise up, and again, it's going to require you. Let me say this too: telling your story many times in many different ways. So we have to figure out who we're talking to and try to figure out what those points are. But again, we can't do this without naming past harms and these past systemic issues that have contributed to, how we got to where we are. So hopefully that answered your question.
Thank you. Yeah.
You're welcome. I know that I believe that we're running a little bit low on time. And one thing I wanted to you all to do, is to kind of break out in groups and practice telling stories, practice crafting stories and crafting narratives. Um, I am going to share the exercise in the chat. I don't think we have time to do breakouts, but I'm just going to share it and see if perhaps we can take a few minutes for you all to just kind of take a look at it and take a stab at crafting a narrative, or maybe just thinking about the things that you might highlight when trying to craft a narrative around these particular issues. I'm gonna try to put it in the chat here, and I will also get you guys some more resources to share and think about. So this is the exercise we were going to go over, and this is similar to one that we share when we do this over the course of a day or half a day, depending on our time. So, this is a situation where probably similar to many of our situations. We work in communities around an issue. This particular one is about Black maternal health. We've done some listening sessions. We've looked at all the data, all the numbers. Thank you. I can see the slides now. Thank you. And we've heard what people have said, that the statistics are there, but they're not driving change. So how can we kind of think about what we've heard, think about the things that we know, and really kind of put together a narrative for participants like healthcare leaders, public health professionals, funders, to really start to drive them toward action, towards some real action that we want to see. So to save your eyes, I did share the document in the chat, so you can click on that and maybe read over that. And if maybe we could take 5 minutes to kind of think about what you might do or how you might start to craft a story. We'll do that, and then maybe if anyone is so bold and wants to share how they're applying this, then that would be great. And let me know if you have any questions, because I don't. Hopefully, I explained that okay. So I'm going to take facilitator privilege and give you 6 minutes. So 2 o'clock. Clearly, there's no judgment. Y'all saw how I started out. So please
Well,
don't feel any kind of way. Yes.
I don't have a plan, but
Okay.
just thinking about, the things you went over, I mean, a lot of things jumped out, making sure to take those data and not lead with it, but craft stories that make those experiences alive, not craft the stories, but, you know,
Hmm.
share the stories that make those data alive. And also to include, and just looking at what the mother shared, um, to establish or reinforce um, that agency and power and the structural barriers, to include in the stories not just the bad things that happen, but what the mothers did to try and seek what they needed, all of the ways that they were resourceful and you know persistent in trying to work with the system to get what they needed.
Hmm.
um I think would be an important element.
Absolutely. Thank you for sharing. Anyone else can share maybe what you thought about or what you'd like to lift up, or again, how this felt thinking about this.
I'll chime in.
Mhm.
When I read that, I just feel that within the medical profession here in the U.S., that some people are not taken seriously. And as a Black woman myself, I find it very disheartening that Black women continue to deal with this sort of thing when they put their lives in the hands of people who are supposed to ensure their health and safety when giving birth to a child. Uh, this is just continuing to be mind-boggling to me. Um, and I don't know. I kind of feel like there needs to be some communal organizations that step up. I know that we have a lot of doula programs, but even with doulas, some of them are being banned from hospitals. They don't want them in the labor and delivery rooms. But I think there has to be some sort of collaboration to ensure that women are being heard, and that their health and safety is being taken into account.
Mhm. Thank you for sharing that. And something you said, again, to kind of tie it back to crafting narrative and what makes a good story is important to remember. And it kind of touches on the conversation we had before about how do we get folks to understand how this work benefits us all, is that we are all part of community in some way. And there's something that we can relate to as well. We have experiences as well, even though we do this work. We get paid to do this work. We still live lives, right? Like as you said, you're a Black woman. So you understand. I interject my experiences and stories, similar to this as well. I'm a Black woman who gave birth too, and for 38 weeks couldn't take a full breath because I was nervous about the outcome. So it lends that authenticity, to that familiarity when you also share your experiences, when you're also open enough to share your experiences and really make that story, again, more familiar, more relatable. And there could be someone who makes decisions, who is also in that situation or knows someone in that situation. So being able to kind of share your experiences as well is a really big part of narrative too, being open to do that. So thank you.
Thank you.
Mhm. There any others? Anyone want to share anything else again about the story, or how it feels to create stories, or stories similar to this? And I don't mean create as in making up, but craft.
Sorry, it's me again. I keep
That's
talking.
it. Sure.
um just a note also about that there's a lot of different people involved with people's birth stories and
Mhm.
the stories of the birth workers, the midwives, nurses, the
Mhm.
doulas, their how they've experienced the disempowerment, or what's
Yeah.
the alienating
Yeah.
and
Yeah.
dangerous way that the system interacts with the mothers that they and babies that they've helped, and how counter that is to why they went into the profession, could be very powerful and resonate with people at the convening.
Absolutely. And that goes back to what we shared earlier about considering the messenger, or choosing your messenger strategically. And again, I think we've seen, and I'll try to share the link. There's a whole thing about the danger of a single story. There's so many perspectives about certain issues that can and should be shared and are important to share, so that again we don't make sure that there's one prevailing narrative, if you will, that's out there that starts to really change that public perception, but that we're sharing about how all people, or as many people as possible, experience certain issues, and particularly inequity. Thank you. um if there are no more, and I don't want to not have anyone share if they're so driven to do so. But I'll leave you with this one thing to consider. When we're practicing crafting stories and thinking about narrative, is to start with you. One of the things we do in this is to think about the story of your name. How'd your name come to be? Thinking about a story around that, and even why you're in this work. Everybody has a story to tell and to share. And it doesn't have to be, as someone pointed out, we don't have to focus on trauma. Like you didn't have to walk to school 12 miles in the snow. But what is your story? You still have a story that someone can relate to, that someone can use to kind of change their actions, change their value system again toward a more equitable system. So just think about your story when you're starting to do this, and practicing the work that we do. And please continue to do all of the good work that you do. So I'm going to stop and turn it over to my colleague, Kirsten, to wrap us up. And thank y'all again for rolling with me. I appreciate it.
Thank you, Robin. That was wonderful, especially considering the technical difficulties. Just wanted to thank you all so much for your participation, and for playing such a role in the conversation and really being engaged. We really appreciate hearing from y'all. And I know that there were some questions that weren't asked or weren't answered, sorry, from the chat. And so we will make sure that some of that conversation continues. So we just wanted to let y'all know that next week is our final of 3 webinars in this series, and we'll be hearing from 3 amazing panelists. You'll get to hear from Dr. Sappho, who's with Just Equity for Health, Matthew McCurdy, who is with Black Health, and Maya Robinson with Out of Hand Theater, and also the Grady Health Foundation. So we really look forward to having y'all back. Hopefully you can make it next Wednesday as well, and bring a friend. And yeah, thank you. Omar, I'll pass it to you.
Thank you so much, Kirsten and Robin, for a great workshop. Thanks to everyone for lending us of your time, for being here, giving us a little bit of extra time, and being patient with the technical difficulties. I hope you enjoyed it. If you're still around with us, please take a minute to scan the QR code that's on your screen and let us know, how we do and how useful this workshop and the topics that we're covering, particularly narrative power, are useful to your work, so that we can continue doing better and tailor resources that are useful for your work. So please take a minute to answer our short survey. We look forward to seeing you next week at the same time for the final session of this workshop. And thanks again for all being here, and for our partners at Partnership for Southern Equity for facilitating and giving us this great workshop today. Thank you all.
Omar, I just wanted to lift up that there was a question about the recordings. Are you able to drop in the link for how to find those recordings for those who aren't able to find it?
Yeah, we'll once the videos are edited, we'll upload them into our YouTube page, and we're gonna make them available for everyone. But also happy to share all and any available links thus far over the Eventbrite email, so that you can reach anyone who registered. They can take advantage of it as well. Thank you for uplifting that.